when it comes to missing gaps, we really want to think about why we're replacing them. Is it to add more units when we're biting? Is it for aesthetic reasons, like smiling? Or are we just doing it for preventative reasons, like, for example, preventing our face from collapsing in later down the line? And we've got to think about why we're doing it and what we want to achieve out of it. And that's why we as dentists provide you a whole range of different options. We've got dentures, we've got bridges, and we've got dental implants. When it comes to dentures, they're a removable option that we can provide to our patients. They're cost effective, they look really natural, and they can easily slot in and slot out of the mouth, which means that they're quite easy to clean. The things that we know about dentures is that as they're removable, they tend to be unstable. And so when you are speaking or eating, they may rock. They also have a tendency to have some food get trapped underneath. And we've got to think, on top of that, we've been all these years without something in our mouth. Do we really want something in our mouth at this stage? Don't know. And the last thing is, with dentures, we carry on losing the bone underneath because there's nothing to support or anchor the bone and provide it with energy to sustain itself. The second option now, when it comes to dental bridges, there's really two types. They're both fixed. One is a sticky bridge, which kind of works like a clip-on tie, and the other is a conventional bridge. Now, going back to the first type, when I say it works like a clip-on bridge, it's got one metal portion that goes behind the tooth next door with super glue, and it's got the fake tooth attached to this metal wing. A couple of good things about bridges is that they have a short treatment time, okay? They're highly aesthetic. However, they can tend to debond, especially if they're super glued on, okay? And that means that we could be eating, we could be out on holiday, and it just debonds. They can be unpredictable, okay? Now, the other type of dental bridge, where I mentioned that the adjacent tooth or teeth are shaved down, okay, for a crown with a fake tooth in the middle of it. That not only means more of your tooth structure going down the drain, but also we're getting closer to the nerve in the middle of the tooth. That means that nerve becomes more sensitive, and also that nerve is more likely to get irritated and unfortunately die. If it dies, we're looking at root canal treatment to save it. And as a lot of our patients are aware, root canal makes teeth brittle. If they're brittle and then, let's say, we only need one tooth shaved down for this bridge, that breaks off and we've got a gap for two teeth. Then what do we do? Luckily for us at JR Medical and Dental, we offer dental implants. This is where we can pop a screw into where we've got a missing gap and we can attach either a crown or bridge to this area. The good things about this is that it preserves the bone around the area, it's easier to clean, and it's the most like replacement to a natural tooth that we actually have. The annoying things are that sometimes it takes a while and may involve a small amount of surgery, but in the long scheme of things, or in the grand scheme of things, you'll be more than happy with the result of having your teeth back.